Welcome to our channel. Today we're diving into a critical health topic, lung fibrosis. Do you know what lung fibrosis is and how it affects your body? Lung fibrosis, also referred to as pulmonary fibrosis, is a significant health concern. This lung disease influences the deep tissues of your lungs, leading to the thickening and scarring or fibrosis of lung tissue. As a result, severe breathing problems can occur. For those affected by lung fibrosis, understanding the disease's symptoms, causes, and treatment options can be instrumental in managing it and enhancing their quality of life. Let's start by looking at the symptoms of lung fibrosis. Spotting these symptoms early can greatly influence how effective the treatment will be. Some prevalent symptoms include a persistent dry cough that just doesn't seem to go away, difficulty breathing particularly during or after physical activity, extreme tiredness or fatigue, unexplained weight loss, discomfort or pain in the chest, and enlargement of the tips of the fingers or toes, a condition known as clubbing. Each of these symptoms could be a potential sign of lung fibrosis. If you notice any of them, it's vital to consult a healthcare professional. Early detection can significantly improve disease management and potentially slow the progression of the disease. So we've looked at the symptoms, but what about the causes of lung fibrosis? It can be caused by various factors. In many cases, the exact cause remains unknown. However, known causes range from inhaling harmful substances such as asbestos, silica dust, and certain gases, to medications including chemotherapy drugs and some antibiotics, which can lead to lung damage. Radiation therapy for cancer, chronic inflammatory diseases like rheumatoid arthritis and sarcoidosis, and genetic factors can also cause lung fibrosis. Being aware of these potential causes is important for prevention and early intervention. Understanding lung fibrosis and how it affects the body is the first step in effectively managing the disease. Remember, it's crucial to consult a healthcare professional if you experience any of these symptoms. Your health is in your hands, and being informed is one of the best ways to keep it in check. Ever wondered what could cause lung fibrosis? Let's dive in. The exact cause of this condition often remains a mystery, but we do know of a few potential culprits. One is idiopathic pulmonary fibrosis, a specific type of this disease with no known cause. Also, inhaling harmful substances like asbestos, silica dust, or certain gases, often due to occupational or environmental exposures, can lead to lung fibrosis. Certain medications, including some chemotherapy drugs and antibiotics, can damage the lungs. Radiation therapy for cancer is another possible trigger. Chronic inflammatory diseases like rheumatoid arthritis and sarcoidosis can also affect the lungs. And don't forget about genetics. A family history of lung fibrosis might increase your risk. While these known causes give us some insight, it's important to remember that lung fibrosis can still occur without any of these factors. Knowing the potential causes can help you take preventive measures and seek early intervention. While there's no cure for lung fibrosis, numerous treatments can help manage the symptoms. This is the first thing we need to remember when we talk about managing lung fibrosis. The primary goal is to ease the symptoms, slow the disease's progression, and improve the quality of life for those affected. Let's start with medications. Antifibrotic drugs are often the first line of defense. These include medications like nintedanib and pirfenidone, which can slow the progression of the disease. Corticosteroids can also be used to reduce inflammation and improve symptoms, but treatment isn't limited to medication alone. Oxygen therapy is another common approach. This involves using supplemental oxygen to help patients breathe more easily. It's a simple yet effective way to manage the shortness of breath that often comes with lung fibrosis. Next, we have pulmonary rehabilitation. This is a structured program of exercise and education designed to improve physical conditioning. It's not just about the lungs, it's about the whole body. A stronger body can better cope with the symptoms of lung fibrosis. In severe cases, a lung transplant may be considered. This is a significant procedure with its own risks and benefits, but for some, it can be a lifeline. We also shouldn't overlook the power of lifestyle changes. Quitting smoking, eating a balanced diet, and staying physically active can all help manage the disease. These changes may seem small, but they can have a big impact on a patient's quality of life. Lastly, there's supportive care. also known as palliative care. This is all about providing relief from the symptoms and stress of the disease. It's a holistic approach that addresses not just the physical, but also the emotional and psychological aspects of living with lung fibrosis. Lung fibrosis is a challenging condition, but with the right approach to treatment and management, patients can lead a better quality of life. Remember, if you or a loved one is experiencing symptoms of lung fibrosis, it's crucial to seek medical advice promptly. Early diagnosis and intervention can make a significant difference. Thank you for watching our video on lung fibrosis. If you found this information helpful, please give us a thumbs up and subscribe to our channel for more health and medical content. Stay healthy and take care.